We're here at the Robotic Expo. Mary Washington has really invested in our community and in our surgeons and has gotten new equipment that allows us to do a lot more minimally invasively with the use of robots. So we're here allowing the community and other staff members to come and check out the different robots and see what we do.
An event like this is great for the community and the people that work here. Gives them an opportunity to see the technology that's available to patients in our community and the investments we're making to increase the complexity of care we're able to provide.
We actually got 2 new robots. They're called the DV5. They are the latest robots that Intuitive makes.
I use it for hernias, gallbladders, emergency trauma surgery. It provides beautiful magnification, 3D imaging that I see like I would see if I'm in the patient's belly, physically opening the patient up. And it just gives me almost 3-dimensional area where I can go around certain organs and structures and do surgery in a very precise manner.
The benefits of it is we are able to do those operations, do small incisions that really make great strides in getting them into the operating room, getting them out, and getting them home very quickly.
Patient outcomes are really good. Quicker recovery, decreased length of stay in the hospital, less pain, back to activities a lot faster. They just overall seem to do a whole lot better.
So weight loss surgery is a pretty complex operation involving usually removing part of the stomach or changing the intestines. So with the new technology, we have a lot easier way to do this. We have a very precise tool, the robot, to help us to connect the intestines, to remove the intestines, and so we can complete the surgery very safely.
We're very fortunate to have this technology. We have 5 surgical robots, and we have now at least 1 bronchoscope robot.
We use a platform called the ION. What we use that for is to help diagnose lung cancer early. We use it endoscopically. It's down into somebody's airways where we can biopsy nodules and then diagnose and hopefully treat patients earlier and lead to better prognosis.
It identifies where you are within the airway and uses a CAT scan to map out the airway, and then it takes you step by step, turn by turn, to the nodule that you're going to biopsy or you're going to treat with some type of therapy. It's exciting to be in this field because there's always something new just around the corner.
This is our orthopedic robot at Zimmer Biomet. It performs total knees, partial knees, total hip, and soon to be total shoulder. With Mary Washington adopting this and having 3 years of experience with 5 surgeons using it, they've proven their devotion to innovative solutions for orthopedics, along with other specialties too, as I look around this room.
We're on the forefront. We're bringing in tools that other places don't have or don't have yet. That allows us to gain expertise. It allows us to really deliver care in many facets to many patients. We're proud of our robotics program. We've been doing it for a long time. That's what you want to look for in a program when you're looking to have your procedure done. One that's stood the test of time, has been doing it for a long time. Mary Washington has always, I think, put the community first, and it shows when they bring in this type of technology.